Welcome to United Way. We're so happy that you're kind of tuning in to take a look at what we're doing. We're very proud to be committed to stopping substance abuse here in Broward County. We're using the SBIRT strategy with multiple partners to prevent substance abuse, to reduce substance use, to make our families healthy, happy, and thriving here in Broward County. SBIRT is a nationally recognized, evidence-based, outcome-oriented strategy, can be used in multiple settings, easy to implement, but very effective. So one, we want to thank our partners in this effort. We're going to ask you to join us to make Broward County the happiest, healthiest, drug-free environment. And again, it's just so proud of partners and what we're doing here in the community and of SBIRT. And please get to know us and get to know our partners.
What SBIRT does, it provides the entire community a tool to not only detect but to intervene at an appropriate time in order to create more wellness in the community. What SBIRT allows us to do is to expand the prevention intervention into our medical facilities, into other community providers that can easily detect and also refer our families, our friends, our children to receive the appropriate treatment or guidance. And when we have early intervention or when we can have the appropriate resources in a community, we improve our chances for everybody's well-being.
At Broward Regional Health Planning Council, we're using the SBIRT tool as an intervention early on in the admission process and throughout the competency restoration training process. We use it as an intervention in order to conduct risk assessments to get a comprehensive view on the substance abuse history, the client history, and to further ensure the client's successful reintegration into the community. And utilizing this tool as a risk assessment and also as another magnifying glass in order to peer deeper into the client's life, hopefully we can make those assessments, those interventions, provide those brief counseling, those brief solutions for them, make the referrals and the recommendations into the community so that we can have a long-lasting treatment plan that's successful, that ensures their reintegration, that supports the family, the individual. Our job is to work and collaborate with them, assess, and link them to those services to ensure a happier individual and family system.
It really does a great job in helping us capture what kind of change you have in the participants that you work with. It helps us to communicate more efficiently and effectively between organizations as well as internally with our own organization. Also, too, it helps us to determine whether or not our services are effective in a standardized, measurable way. You know, we're really fortunate to have the SBIRT as a tool that we can use easily and every day.
Our clients have been able to build rapport with our therapists, and has been a nice, easy transition into their treatment. Our therapists have been able to easily assess the type of level of care for each of our clients in order to refer in our community. And this has been very impactful for our agency as well.
Using the SBIRT assessment at PACE Center for Girls has not only increased the participation in the girls of their assessment, but it's also helped the counselors and therapists really understand the needs of the girls. It helps us to understand whether they need an intervention or prevention level of services. The counselors and therapists enjoy using the SBIRT assessment. It's quick, it's user-friendly. They're really enjoying the web-based application of the process. The girls enjoy knowing that their scores can decrease from the time they start with us to the time that they end their counseling with us. And when they end their counseling with us and they see that their scores have decreased, they get excited and they know that the hard work that they've put into their counseling and their therapy has really shown. We like to use the information from the reports stats of the SBIRT assessment to share with our counselors and therapists every month to show how many assessments we've completed, the concerns that we've had with any of our assessments, and also the positive outcomes that we've been able to provide to our girls with the assessments.
The SBIRT assessment has become an important tool. It's being used by our case managers and youth counselors to do an initial assessment on our youth. This assessment has helped Hispanic community of Florida and the Youth Development Program to lower risky behaviors among youth. This tool is helping us also to increase our education and awareness about alcohol and drug abuse.
One of the benefits that we've seen of using SBIRT with Broward County school students is we've really been able to demonstrate to the students their severity of risk by going through the questionnaire and then printing out the scale that actually demonstrates to them where they fall in their risk and what the appropriate treatment level is. That has really been very motivating with our students to help them to see their need for treatment. We've seen really great results just within the first school year that we're using it.
It is easy to use, friendly, and we find that it's really effective and impactful in making sure that we're doing the best to ensure that Broward County has the top of the line prevention services. It's literally saving lives. So if more agencies were to implement this program, we would see a wide dramatic change in the number of youth who are suffering from marijuana addiction, alcohol addiction. So it truly is a program that literally saves lives.
The organizations learn about not only the national evidence-based program, but also our local approach to implement SBIRT, how to outreach the target population, how to utilize the tools, how to enter data into the system for evaluation purposes, how to engage customers, how to assess their needs, how to provide screening and then the intervention and then the referral, how to make sure that the staff is prepared in order to implement the program. So making sure that they know about cultural competency, they know about motivational interviewing, several skills that are necessary in order to make sure that SBIRT is implemented in a way that is appropriate.
Because we see it as an innovation in the prevention arena. It's a great way for families, for individuals, to identify if they have any risk associated to substance abuse, and for the providers to link them to the appropriate services in the community. In the last year, United Way Commission on Substance Abuse has been offering free trainings to providers. Our goal is to make sure that they are ready to start implementing SBIRT. If you would like to participate and be part of this collaboration, please reach out to us.
We're always looking for ways to partner. We're always looking for different community actors to come join us in help promoting wellness in our community. Find out more about SBIRT, and we look forward to hearing from you.